In the name of God, the beneficent, the merciful. This time we reach to the female reproductive system. The same as the male can be divided into external and internal genitalia. Female external genitalia includes the mons of pubic. Here, this part show the mons of pubic. The labia majora, two half on the left and right side. Labium majora, the labium minora. These two skin fold refer to the labium minora. Clitoris. This one is clitoris, and the vestibule of vagina, and the another part refer to the bulbs of the vestibule and the greater vestibular glands. These three last, I should clean some parts that we reach to the deeper part, and then we will discuss about that. Labium majora. These are two thick folds of skin enclosing fat. They form the lateral boundaries of the pudendal cleft. This part should be the pudendal cleft. And as you can see here, the large anterior ends of labium majora connect to each other below the mons of pubic to form anterior commissure. The skin connecting the less prominent posterior end of the labia is known as the posterior commissure. The area between the posterior commissure and anus, I mean this part that I determined by this flash, uh, constitute the gynecological prenome, because this part is very important for the doctor in delivery. If the tearing of the vagina happen to this direction, it cause problem for the patient. So this part, this area, gynecological prenome, is very important. uh, the labium minora, these are two thin folds of skin which lie within the pudendal cleft. I mean, here is pudendal cleft. Anteriorly, each labium minus is split into two layers. The upper layer joins the corresponding layer of the opposite side to form the periprus of clitoris. So it here, as you can see, in left and right, can split in two layers. This one make the prepuce of clitoris. Posteriorly, I mean below the clitoris, made the frenulum of the labium minora. And the clitoris is an erectile organ homologous to the penis. It is not traversed by the urethra. This is the urethra, is quite separate from the clitoris, and the body of the clitoris is made up to corpora cavernosa, enclosing the fibrous sheath, and part is separated by the incomplete pectiform septum. I will show you in another picture. And as you understood, a corpus spongius is absent. Okay? The space between two labium minora is the vestibule of the vagina. And the following features we expected being at the vestibule of the vagina. The urethra, as you can see here, an orifice is about 2.5 centimeter behind the clitoris, and the vagina orifice, this is belong to the vagina. Mm, Vagina orifice lies in the posterior part of the vestibule and is partly closed, okay, in virgin, of course, by membrane called hymen. Here I try to show you the hymen. Uh, the orifice, the orifice of the ducts of the greater vestibular glands is not shown here, but just you can see the opening of the greater vestibular glands ducts here between the hymen and the labium minora. Numerous lesser vestibular or mucosal gland open on the surface of the vestibule. Um, the posterior part of the vestibule between the vagina orifice and the frenulum of the labium minora. This is the frenulum of labium minor. That was frenulum of clitoris, and posterior end of the labium minora made the frenulum of the labium minora form a shallow depression, I mean here, known as the vestibular fossa. In this picture, I removed the labium majora and minora to show the two corpora of the clitoris. This is the clitoris and right and left corpora that attach to the ischiopubic ramus, and when I remove and made a cut through the labium majora and minora, under that you first you can see the bulbu bulbu spongius muscle here, this muscle fibers, and these muscle fibers belong to the deep perineal. We will discuss about this later, okay? When I made a cut or remove the bulbo bulbo spongius muscle from here, under these muscle fibers, you can check the bulb of vestibule that posteriorly overlap the greater vestibular glands on the left and right side is here. I'm sure you can remember bulbourethral gland in male, and these are greater vestibular glands. Greater vestibular gland that you can see here in this side is at the superficial perineal space, but in male the bulbourethral gland located on the deep perineal space. So here is the anterior end of the perineal diamond, okay? And I mean here you face to the symphysis of pubic, not shown here, but the left and right crus of the clitoris is clear, and as I mentioned before, we have not expected here being the bulb, the same as I mean take part to the making the clitoris as we had in male. I mean when we made a cut through the penis, because it's a homologue to the penis, okay, without corpus spongius. So bulb of vestibule are two oval bodies of erector tissue that correspond to the two halves of the bulb of the penis. Okay, in men, these are not divided into two halves, but here in female, there are two halves, right and left. The right one is covered by this muscle, Goodway spongius, and here we made a cut and remove these muscles. You can see the left half of bulb. As you can see here, the bulbs lie on either side of the vagina and urethra orifice, superficial to the perineal membrane. I mean here, this tissue point to the perineal membrane. Look carefully. The tapering anterior ends of the bulbs here are united in front of the urethra by venous plexus called the bulbar commissure. Commissure of bulbs. Bulbar commissure. The expanded posterior ends of the bulbs partly overlap the greater vestibular gland on each side. Greater vestibular glands or Bartholin's, greater vestibular or Bartholin, these are homologue with the bulbourethral glands or Kupfer in the male, but unlike them, these lie in the superficial perineal space at the vaginal orifice. Now let's have a look to a sagittal section through the external genitalia. In female, you can see the symphysis of pubic here. Posterior than this, the fat and urinary bladder, urethra, and at the base of the urinary bladder, this is the vagina, and posterior than this is the rectum. Here, this is the clitoris, the left crus, and the body of the clitoris, labium majora here. So between this and the right side, pudendal cleft, and this one is labium minora. Here is the orifice of the urethra, and here there is the orifice for the vagina, and hymen being closed this orifice. Posterior than the vagina, this is the perineal body. I told you in male, posterior than the prostate located here, and there is not vagina in male, but here filled by perineal body. So this is the perineal body, and here this space here is the perineal space, and here this is the superficial perineal space. You cannot see the Bartholin glands because the section not going through that glands. So if this be the vagina, it should be the uterus. Okay, uterus bent on the upper surface of the urinary bladder, and on each side you can see the ovary. In male, gonads change to testes and descend to the scrotum, but in female they stay in pelvic. The gubernaculum, the remained part of the gubernaculum in female, made two ligaments. One of them is this round ligament. Round ligament is going to leave the pelvic from the lateral side of the uterus through the deep ring. This is the deep ring, and reach to attach to the labium majora. We will discuss about this in detail in near future. So if this be the ovary, it's the same and homologue of the testis in male. Each ovary lies in the ovarian fossa. So we expected here being the ovarian fossa on the lateral pelvic wall. The ovarian fossa is bounded anteriorly. Here is the anterior boundaries by the obliterated umbilical artery. Obliterated umbilical artery goes through this part. And posteriorly by the ureter and the internal iliac. Here we expected we have internal iliac vessels and ureter. I will show you this in another picture. The position of the ovary is variable. In nulliparous women, means women have not any childbirth, its long axis is nearly vertical, same as this. But in multiparous women, the axis become horizontal. I mean, in woman that not having childbirth, it has upper pole and lower pole, but in multiparous, it should be, I mean, the upper pole look to the lateral and inferior pole looks to the medial. The ovarian fossa is better shown here. I mean the ureter here and internal iliac vessels goes posterior than the ovary, and here an obliterated artery crosses the anterior wall. This is the fallopian tube. Fallopian tube crosses the medial surface and goes to near to the upper pole or ovary. This ligament is ligament of ovary. Ligament of ovary and tres ligament, round ligament of the uterus are the remainder parts of the gubernaculum in female. Each ovary in young girls before the onset of ovulation, the ovaries have a smooth surface and a grayish pink in color. After puberty, the surface become uneven and the color change from the pink to gray. Each ovary, as we expected, have two poles, upper or tubal. Upper or tubal is so close to the uterine tube, and the lower or uterine pole, and two borders, anterior borders and posterior border, and two surface, medial look to medial side and lateral so close to the lateral wall. Arterial supply of the ovary. The ovarian artery arises from the abdominal aorta, just below the renal artery. We discussed about this before when we have scission for the aorta. It descends over the posterior abdominal wall and enter the it comes down, and when it are going to supply the ovary, it goes through this ligament. Here there is a ligament, suspensory ligament, so it is a peritoneal fold. By this reach to the anterior border of the ovary and supply the ovary and uterine tube, and finally anastomose by the uterine artery. So first, the arteries that supply the ovary is ovarian artery, and second, uterine artery. Uterine artery gives some branches which reach the ovary through the meso-ovarian. The drainage of the venous drainage is, it's drained by a pampiniform plexus around the artery. The plexus condenses into a single ovarian vein near the pelvic inlet. This vein ascends on the posterior wall of the abdomen, same as the venous of the testis, and on the right side drain to the IVC, and on the left side drain to renal vein. The lymph of the ovary, the same as testes, should be drained to the lateral and periaortic lymph node. But not to forget that the lymph from the uterine tube and fundus of the uterus. Here, this is the fundus of the uterus and the uterine tube. mm, uh, I mean the lymph from the ovary communicate with the lymphatics from the uterine tube here, as you can see here, and fundus of the uterus. They ascend along the ovarian vessels and drain to lateral and preaortic. The ovarian plexus derived from the renal, aorta, and hypogastric plexus accompanies the ovarian artery and reach to the ovary.